All right, everybody, good afternoon to all of you, and welcome to today's community forum. And I see that we have about 86 and rapidly rising folks coming into our virtual room, and we're likely to get a lot more as we go along. So, I'm John Finnegan. I hope you know who I am, and I'm going to introduce today's forum presenters shortly, who will lead us in a discussion about our school's strategic plan for anti-racism. But first, I would like to recall that our school, the University of Minnesota Twin Cities campus, and actually most of our homes are situated on the ancestral land of the Dakota people. We acknowledge the ongoing debt that we owe the Dakota people and also their permanent relationship to this land. We strive to create healthy dialogue, relationships, and practices that address injustices past and present, as well as others affecting all of the indigenous people of Minnesota. Well, it is no surprise that racism is embedded deeply in the structures and systems of our society throughout U.S. history and down to the present day. And it is a powerful social determinant of health that keeps whole populations and communities from achieving the health and well being that everyone deserves. And since last May, following the murder of George Floyd, hundreds of local, state, and national leaders have declared racism a public health emergency. Racism has no place in the School of Public Health, and we are determined to shape our school into one that puts justice, equity, and inclusion and anti-racism at the center of its missions and daily operations. Our strategic plan for anti-racism, which I hope you know launched yesterday, is the touchstone for our work, and it will guide us over the next 5 years and perhaps beyond as it evolves. Hundreds of SPH faculty, staff, students, alumni, and partners were engaged in developing this plan, including each member of the school's leadership team. We've made this plan a top priority in our work, and we have committed to providing the necessary resources to achieve our goals and strategic vision. Now, over the past year, we established the SPH Office of Diversity, Equity, and Inclusion, and it has a designated budget line, and we also promoted Lauren Eldridge to direct that office. Gail Smaller Jr. joined us recently, and we have plans to hire a project coordinator this fall who will manage implementation aspects of the plan and ensure that we stay on track. We are also in conversation about identifying space for the DEI office in the Mayo building. And as the strategic plan gets underway, we will continue to allocate more resources centrally and through divisions and other units. Now, although we have created this plan for SPH, it has generated interest that goes well beyond our school walls. Other organizations are eager to develop their own efforts, and they are looking to SPH for insight and inspiration. Lauren's been invited to present at local and national meetings, including the ASPPH Sections Retreat, for which I had the honor of joining her, NCORE, the Minnesota Department of Human Services, and the University of Minnesota Diversity Community of Practice. We are beginning to be seen as a leader in this work, and there will be many eyes upon us as we begin implementing our plan. Now, this doesn't mean that we're going to be perfect or need to be perfect in our approach. As a top 10 school of public health, however, we must be an example of how commitment and hard work can move this school and any school closer to the goals of justice and inclusion. So our implementation, we want to be an authentic reflection of our school. As we gain experience and practice, the document is going to change to reflect the changes that we want to see. We want to use this document as a living thing for us in reflecting on that change and our experience. So the most important thing to remember is that each member of our community must play a daily active role in achieving the change that we seek. Indeed, to be anti-racist is to be actively and consistently challenging racism in all of its forms, but especially in its systemic manifestations. And now it is my pleasure to welcome our presenters, starting with Lauren Eldridge. As director of the SPH Office of Diversity, Equity, and Inclusion, Lauren leads our strategic planning efforts together with the Strategic Planning Committee and the DEI Action Alignment Team. And Lauren is joined today by Gail Smaller Jr., our SPH Coordinator for Diversity, Equity, and Inclusion. As you know, Gail leads many initiatives related to the plan and will continue to play an integral role in its implementation. So today, Lauren and Gail are going to share information about the goals and the structure of our strategic plan, along with measures of accountability and ways that you and all of us can be involved. Following Lauren and Gail's overview, presenters from across the school are going to share examples of division and unit-based efforts that are aligned with the plan. And these presenters will include Diane Newmark-Steiner, professor and head of the Division of Epidemiology and Community Health, Marta Shore, a lecturer in the Division of Biostatistics, Tim Beebe, Mayo professor and head of the Division of Health Policy and Management, and Gail Smaller Jr. and Heidi Mestrude, Director of Alumni Relations. Now, after the presentation, we'll split out into breakout sessions to engage in conversations with each other, and then we will reconvene for a full group discussion. And with that introduction, I am very pleased to turn the mic over to Lauren and Gail.
Perfect. Thank you, John. I appreciate your words there, and also want to point out that Gail was with me for those other presentations, and we really enjoyed speaking to different audiences. So we're going to talk about this plan. First of all, I did want to lay out what the vision is for the School of Public Health as it relates to diversity, equity, inclusion, and anti-racism. So first, we want to make sure that we're centering people from marginalized communities, particularly folks from Black, Indigenous, and people of color communities, but that does not exclude for folks who are disabled, folks who identify as LGBTQ, or folks who are from outside of the US, et cetera. And so we want to make sure that we're recognizing that oppression is a very complicated and intentional and ongoing interconnected system of concepts, and that no particular group has a monopoly over oppression. But we did want to recognize the importance of racism and how important it has been in shaping the lives of citizens in this country. Secondly, we want to align our efforts and resources across the school. We know that work has been being done for a long time across the school, well before I stepped foot into the school, across divisions and at the central level. And we wanted to make sure that the resources that we're using, the consultants that we're calling to, the programs that we're putting on are actually in alignment with one particular plan and vision. We want to hold ourselves and each other accountable to our goals and our values. We want to invite new community members into our vision for work, into our vision and work for equity and justice, which does include employees and students, but also community members. And we also want to raise consciousness and empower our community to disrupt harmful patterns of oppression everywhere we see them. And next slide. Why are we doing this? So we wanted to establish some very clear school-wide goals. Again, we do recognize that the work is being done across units, but we had a vision for making sure that it could be done on a school-wide level, and then that divisions and units could fall into place within that. We wanted to make sure that we could leverage our resources, which includes dollars, but also people and spaces and everything, and make sure we're working together. We want to provide sustainable support for our divisions and our unit initiatives. We want to remain competitive across other schools of public health and programs of public health across the country. And finally, and most importantly, it is a moral imperative that we put anti-racism at the top of our priorities. We really do value health as a human right, And if that is the case, then we need to make sure that we're battling oppression daily. So how do we intend to do this? So on the slide there, you do see a really quick snapshot of the plan, which is about 30 pages. So if you got a chance to look at it, I do appreciate that time. If you haven't, please just take a look. We did have an executive summary here. And so if you don't have time to look at the whole thing, that gives you an opportunity to just kind of see what it looks like in a shorter format. But the work entails teamwork as well as individual reflection and improvement on a continual basis. There is no end goal here. We absolutely have to be working for justice day and night from cradle to grave, essentially. We want to make systemic changes and process improvements in areas such as hiring, curriculum, research, development, et cetera. We need budgetary commitments, which we have from school leadership. We want to make sure that our goals are nimble. So this is a living document, and we will add and change it as we need to. We'll have regular communications across various channels, which we have already started. And of course, support from the university and school leadership, which we have already established, but we sent this plan out to our university leadership this week as well. And so we're excited to see how this creates waves across the year. We did want to highlight a few points from the timeline of this plan. So we started this last year in January. That's when we first engaged strategic diversity initiatives as a consultant and hired them on. We started meeting on May 11th as a strategic planning committee. Just a couple weeks later is when George Floyd was murdered, not too far from campus. And so that kind of lit a fire under us. We already recognized the work was important, but I think that really highlighted how critical it was to the lives of people of color in this country, but in this area as well. And so we've been meeting monthly since then to get this plan together. We wanted to recognize the importance, but also be very intentional. And so we took as much time as we needed to get this completed. So we are now in the summer phase. We have launched in this particular format, meaning all of you, but our students are not here yet. Some of our faculty are not returned or haven't started yet. And so we will continue doing launch into the fall, as well as activities over the next 5 years. Who is involved in this? Everyone here, as well as the other folks who are not here today. So SPH leadership, Gail and I, and whoever else we add into our team. The DEI Action Alignment Team, which is tasked with the implementation of the strategic plan. Each committee that is related to anti-racism and DEI in the divisions. The Strategic Planning Committee, which really put the hard work into writing this plan, but we will probably reconvene at some point to continue to edit it. The consultants that we hire and have hired, and of course, all of you and myself included. And then what can I do on an individual level? Gail, do you want to take this one?
Sure. So as you all know, we have a theme for our plan: building equity, driving justice, commit, challenge, change. And those 3 words at the bottom, we really, as a group, as a communications team, and Lauren and I, we really sat and discussed what do these 3 words mean? How are they going to kind of promote action and motivate folks to get involved? And so we really wanted to highlight 3 very specific ways of what you all can do, as well as what we can do to continue to motivate and push this plan forward. So 1, commit, right? You all can commit to the plan by emphasizing a pledge to prioritize anti-racist efforts in SPH. These efforts are on a large scale, but also in your divisions and in your units and in your classrooms, right? challenge. We are often challenged to accept that racism exists. And so we also have to challenge it when we see it. We have to call it out. We have to really make a name for it and show folks that we actually care and we notice racism is there and we're not going to allow it to exist anymore. And then we have to change. We have to be willing to change. We have to be willing to shift our beliefs, our attitudes, actions towards equity and justice, in our entire perspective, right? Not saying that any of us have it right. Lauren and I don't have it 100% right either, right? And we're all committing, challenging, and changing together as a unit and as a collective unit. And in addition to this, also with you all will hear from your supervisors as well as other folks, different ways that you all can get involved in the plan moving forward too.
All right, so now that we've shared an overview and examples of ways we can be involved as individuals and as a community in our work towards anti-racism, I want to take a deeper dive into the plan. The plan is organized into 5 goal areas, which you can see here. Each area includes a vision, stewards, and a set of goals that will be achieved through detailed actions and tactics. So the first goal area is leadership. The vision for this area is to provide clear and consistent leadership to challenge racism in any form and create an environment that is affirming, accessible, and equitable for people from marginalized communities. The dean is the lead steward with all of his direct reports serving as additional stewards. I'd like to invite Diane Newmark-Steiner, Division Head and Professor of Epidemiology and Community Health, to the screen. Diane will share an example from her division that aligns with this goal area.
Thanks, Lauren. I'm so excited about this plan, and it's just so timely and so needed. Within the Division of Epidemiology and Community Health, we are extremely committed to the work of diversity, equity, inclusion, and anti-racism. We began this work 5 years ago when we set out on our strategic plan of 2222, envisioning 2222, what we wanted our division to look like. And our faculty came up with 3 areas, and diversity, equity, and inclusion was one of those areas. Our efforts got ramped up after the murder of George Floyd last year, and we established a diversity, equity, and inclusion, action team, which Dr. Tracy Toomey is leading and just working very hard to make this work happen. Our team includes faculty, staff, and students, and our students are from historically marginalized groups, and we do pay them for their work. This group, among other things, has pulled together an action plan which we are now working on merging together with the overall strategic plan. I was asked to talk about leadership, and I want to say that we restructured our whole division to put DEI efforts right at the center. So we have 5 leads now in our program: training, research, programming, operations, and diversity, equity, inclusion. The leader of the DEI work sits on our faculty executive committee, so it's really integrated into all decision-making that is done at the highest level in our division. We have a budget line for DEI work. It's quite a nice budget line. And we have done things like integrate DEI questions into our annual faculty reviews. Some of our activities are listed here. So, it was a major focus of our seminar series this year. We have implemented mandatory training from the Office of Equity and Diversity for our leadership and our faculty, and recommended it for staff. We have just hired a DEI consultant, Paul Robinson, who is working with us in developing the Leadership Institute around DEI. And we've just had some different pop-up activities that have happened throughout the year. So now what we want to do is really work with the school. We've operated at more of a grassroots level. The school now has an overall plan, And that's the way change happens. We have to work from below and from above. So we are extremely excited about this school plan and look forward to working with Lauren and Gail to make sure we get things working at the division level. I have one more slide. If you could put that up. I don't know who's doing the slides. Thank you. I'm not going to go through all of these. These are some of the activities with which we have been engaged. And I just want to point out the diversity supplements and the training grants, because I think this is absolutely crucial. If we can bring in students and fund them, students from historically marginalized communities, that is really how we can make a difference in our communities long term. And these supplements take a lot of time. Someone just had one funded yesterday. It's really been a major focus. So we can talk more about that in our groups. Thank you, Lauren and Gail, for your leadership here, and looking forward to more.
Thank you, Diane. Appreciate your words there and appreciate all of the work that's going on at EPI. So the second goal area is focused on students. The vision for this area is to recruit, enroll, retain, and graduate students who are representative of diverse identities, and particularly from the communities that are most impacted by health inequities. The student learning environment should foster engagement, mutual respect, leadership opportunities, and personal empowerment, as well as reflect inclusive, anti-oppressive, anti-racist values and empower inclusive, anti-oppressive, and anti-racist actions for all students. The Associate Dean for Education and Student Engagement is the lead steward, with several administrative leaders, division representatives, and student representatives serving as additional stewards. Biostatistics lecturer Marta Shore will share an example from her division about an exciting new effort that aligns with this goal area.
Thank you, Lauren, for this opportunity to share our work. My name is Marta Shore, and I'm the chair of the Biostatistics Community Outreach Committee. And today I'd like to talk to you about our collaboration with St. Paul Public Schools. Our work started last spring of 2020, when biostatistics graduate students realized that, given that the vast majority of us grew up upper middle class and are either of white or Asian ancestry, biostatistics must seem like it's not the right field for many students. They decided to reach out to public schools to promote biostatistics and data science in the hopes that more students would see themselves as biostatisticians and biostatistics would become more reflective of the US population. We reached out to St. Paul Public Schools at a critical moment. State science standards are currently being restructured to focus more on exploration of data and less on memorization in all science courses, including those related to public health. And in 2020, St. Paul Public Schools introduced its own 5-point strategic plan around the mission statement, inspire students to think critically, pursue their dreams, and change the world. In other words, it was the perfect time to not only introduce biostatistics to students, but also integrate biostatistics into the curriculum. Next slide, please. This spring, we brainstormed ideas with 3 St. Paul Public School teachers for a new 9th grade earth science class around the subtopic of human sustainability. Teachers guided us both on the standards they need to meet, as well as what would be engaging for their students. Based on their expertise, our PhD students designed an applet that encourages St. Paul Public School students to find the nearest air quality monitoring site to them. This link I provided in the chat if you would like to explore this app on your own. Students can then highlight that site on different visualizations of data as they explore how air quality changes based on natural processes such as weather, the time of the year, or certain holidays. They can then differentiate these natural fluctuations from human influence on air quality, such as median income or proximity to a highway or power plant. The proximity to a power plant is seen in this visualization. The red dots are power plants, purple dots are air monitoring stations, and the green dot was me putting the University of Minnesota's address on the graph to show how students can see it relative to their own residence. Our app is giving kids the tools to discover how the burden of environmental factors is not shared equally among the different communities in Minnesota. Our app will spark a lot of conversations such as, do major highways or power plants seem to be located within low income or Black communities more frequently than white and higher income neighborhoods? And how does pollution contribute to health inequality in Minnesota? We can also respond to student input and add data or visualizations that are important to them. And as students realize they can understand and think critically about data, which is what biostatisticians and data scientists do, St. Paul public school teachers can then link the lessons to careers in biostatistics and data science. I'm personally excited about this work because most of my classmates growing up in a diverse public school didn't even know about biostatistics, much less see it as a possible career. Currently, my kids attend St. Paul Public Schools with some of the brightest and most passionate students and teachers I've ever met. And with collaborations like these, those students can see themselves as biostatisticians or data scientists, using the data to explore issues that matter to them. And I hope we can use our data expertise in conjunction with other divisions in the School of Public Health so students in St. Paul Public Schools can explore their fields as well. And as a bonus, our PhD students have learned how to listen to members of the community about the information they need and how to present that information clearly and effectively. Thank you for this opportunity to talk about our work. Now I'll turn it back over to Lauren.
Thank you, Marta. I'm going to jump in for Lauren here. Appreciate what you all are doing in biostats, especially kind of shifting the narrative and showing folks that there is more to life than what they might think given their environment. So thank you for that. Goal Area 3 focuses on faculty. The vision for this area is to recruit, hire, mentor, support, promote, and retain faculty who are representative of diverse identities to reflect the students we teach and the communities we serve. And it will also focus on developing an environment that welcomes new perspectives, values individual backgrounds and experiences, engages in community efforts, and centers justice, equity, inclusion, and anti-racism. Our Associate Dean for Faculty Affairs leads this goal area. The other associate deans, division heads, administrative leaders, and student representatives, as well as faculty representatives from the FCC, the EPC, and the APT will serve as additional stewards. I'd like to ask Tim Beebe, division head and Mayo professor of health policy and management, to share an example from his division that aligns with this goal area.
Thanks, Gail. And thanks for all the work that you and Lauren and so many others have put into this impressive and important document and plan. So my example is going to really focus more on the second part of this vision, the developing an environment that engages in community efforts and centers justice, equity, inclusion, and anti-racism. Next slide, please. As many of you have heard earlier this year, Blue Cross Blue Shield of Minnesota made a $5 million philanthropic gift to SPH to establish the Center for Anti-Racism Research for Health Equity. The goals of the center are to develop anti-racist research and in the spirit of level setting. Anti-racist research is a revolutionary way of doing health research grounded in the understanding that racism is a fundamental cause of health inequities. It explores how systems, policies, social structures, and historical influences create the conditions for health inequities rather than placing responsibility solely on individuals. The approach also requires that we put the people who are grappling most with these issues at the center of the research design and decision-making. Rachel calls this centering at the margins. Ultimately, the anti-racism research will produce anti-racist findings, change narratives, produce equitable policy solutions, and influence community interventions. So the second goal is to foster authentic community engagement by convening researchers, practitioners, and community members to address the root causes of racial health inequities and drive real action for change. It intends to develop education and training on structural racism, anti-racism, and health inequities for students, public health professionals, and community members. It intends to change the narrative about race and racism to one that does not hold up whiteness as the ideal standard for human beings, more of the assimilationist sort of perspective as opposed to anti-racist perspective. Serve as a trusted resource for public health agencies, policymakers, payers, and the media on issues related to racism and health equity. And as you know, HPM faculty member, Dr. Rachel Hardiman serves as the director of the center. She's a health equity researcher whose program of research applies the tools of population health science and health services research to elucidate the critical and complex determinant of health inequity, which is racism. Like most centers, this Center for Anti-Racism Research for Health Equity will serve as a critical convening venue for interested faculty, staff, students within and outside SPH. Currently, the faculty from HPM, EPI, and Environmental Health Sciences have formal affiliations and leadership roles in the center, and 10 graduate students from across the School of Public Health are supporting or undertaking work that aligns with the center goals. We encourage you to reach out to Rachel if you're interested in working on this. Thank you so much for giving me the opportunity to expound on this very important investment and opportunity. I will hand it back to Gail. Is it back to you or?
Yeah.
Okay, Gail's not sure. Okay, Gail, back to you.
All good. Thank you, Tim. Thank you as well for just going into detail about the center. I think it's going to be a huge part of the continued work that we do within the school around anti-racism. So thank you for that. The next area, goal area number 4, focuses on staff. Similar to the faculty area, the vision for staff is to recruit, hire, mentor, support, promote, and retain staff who are representative of diverse identities to reflect the students we teach and the communities we serve. And it will also focus on developing an environment that welcomes new perspectives, values individual backgrounds and experiences, engages in community efforts, and centers justice, equity, inclusion, and racism. Our chief of staff leads this area. Division heads, division administrators, other administrative leaders, and staff representatives from the P&A Senate and Staff Association will also serve as additional stewards. Now I'm going to invite myself back to the screen to provide some examples. So 2 of the initiatives that we have been specifically focusing on, one, the Staff DEI Conversation Series, which many of you have participated in. Thank you all as well. The theme and focus of that space is we don't know what we don't know. So it's been a space where we have allowed staff to come in, honestly, having no kind of understanding around DEI or little or wherever they are, to be able to ask anonymous questions, and then we discuss those questions within the space, right? The reason that those questions are anonymous is because, one, we don't really need, in this space, we don't really need to out anyone for lack of better words, for their ignorance, right? Like, this is a space to learn, a space where people can actively come and get difficult questions answered that they might be not have answered any other space. This space will continue into the fall. People can still submit questions right now via the DEI website. I will tell you that with the second initiative I'm about to talk about, that space might shift and change and look different, might be coordinated by someone differently or a group of people. Just be on the lookout for more news on that. And then on to the next thing. So as many of you all know, we have had the edit team for quite some time, but we have begun to shift the edit team into this new kind of strategic training initiative space. So the Equity, Diversity, and Inclusion Training Team, or EDIT 2.0, will be the strategic training team aligned to develop and implement DEI-related trainings for the School of Public Health. Any member of the School of Public Health can apply as of right now. The plan is that we will meet monthly to plan and execute training initiatives, ranging from talking about ongoing trainings to thinking about who we might bring for as speakers and trainers for more bigger. More and bigger don't go together, but bigger training initiatives as well. Sarah, if you want to go ahead and click on the link so I can at least show people where our new launch landing page is. So on the DEI website, we have updated the edit team landing page, so you all are able to go there and gain more information about this specific group of people. In addition, if you want to scroll down a little bit, Sarah, there is an application for folks who want to be involved, and there's a link for the application on the site. I'm asking folk we are looking for 9 people to be involved, well, probably 8, 9, including me, but folks to apply by August 12th, which is the following Thursday. So you have about 2 weeks to apply if you're interested in being involved in this initiative. Please have the conversation with your supervisor or those in leadership in your areas to ensure that you actually have the capacity and the time to be involved. Yeah, I think those are the 2 initiatives. So yeah, be on the lookout for these things. I believe that the Edit 2.0 initiative is going to be a huge player in what our training initiatives look like moving forward within SPH.
Thank you, Gail. I really appreciate your work on that and looking forward to seeing what EDIT does this next year. So the final area is goal area 5, which focuses on alumni. The vision for this area is to meaningfully engage alumni in our research, training, and service activities around anti-racism, diversity, equity, and inclusion. Alumni will be seen as valuable partners in this work. Their collective relationships and expertise will be extensions of the SPH student, staff, and faculty community as we work toward building an institution that is anti-racist and committed to diversity, equity, and inclusion at SPH and in the wider world. Our Director of Alumni Relations leads this area. Our Associate Deans and several administrative leaders will serve as additional stewards. Alumni Relations Director Heidi Mastrud will share an example of a school-wide initiative that is aligned with this goal area.
Hi all, and good afternoon. As Lauren mentioned, our alumni section goals include engaging alumni around research and community engagement, workforce and professional development, and the student experience. And for us, the SPH Mentor Program is really essential to achieving the third goal. Lots of you probably know about that program. It's one that matches alumni or public health practitioners in a one-on-one relationship with a currently enrolled School of Public Health student. And I want to talk to you a little bit about some of the changes that we made in the last academic year to the program and our plan for moving forward. First, I'd like to recognize that a member of our advancement team, Sarah Pennebecker, leads the mentor program planning along with a committee of alumni, volunteers who work tirelessly to ensure that the program's meeting the needs of our students. During the last academic year, the mentor program added new options to both the mentor and student applications. And these questions were related to race and ethnicity, as well as other identities that the mentor program committee determined to be relevant. This new set of questions allowed program participants to indicate how important it was for them to be matched with someone with the same identity as them. The team then used the data to inform the matching process. And we had about 170 matches, received over 300 responses to those questions around identity. 60% roughly indicated their preference to be matched with someone of a similar background or identity. And BIPOC students requested a match with a mentor of a similar background at a greater rate than white students. And that was somewhere between 70 and 93% based on the student population we were segmenting into. Additionally, 69% of our students who were applying for the program, who identified as first-generation college students or from the LGBTQ community, also indicated it was important to be matched with someone of a similar background. And mentors and mentees could choose to self-identify. This was all by choice, not a forced question, but they could choose to identify their race, ethnicity, gender identity, sexuality, first-generation grad students, international students, or any other measure of identity that they thought was important to their student experience, such as being a single parent, a veteran, returning to school after a long break, questions like that. And so why does this matter? One of the students that I chatted with had this to say. She said, having a mentor who looked like me and experienced similar challenges as me allowed for a more meaningful mentor-mentee relationship. While sharing the same race doesn't automatically mean that we're the same person in every regard, having a shared identity allowed me to build trust quickly with my mentor, something that was crucial in navigating this predominantly white field. Finally, we designed the program's end-of-year evaluation to better understand if students and mentors from differing backgrounds or identities had different experiences in the program, knowing that we can't improve what we don't understand. Analysis of this data is happening right now and will drive program improvements in the coming year. For next steps, I invite you all to help us make this a success. The need from our students is greater than the existing mentor pool. We will need to recruit more mentors that specifically fulfill the needs and preferences of our student body. BIPOC mentors in particular. And we need your help with this. So as we begin to recruit for the next school year, please help us by amplifying messages, recruiting BIPOC alumni and public health community members that you know in your network, and ask them to consider participating in the program, knowing that this is a really important part of the student experience and can help our students be successful. And finally, I just want to say this, our mentor program is very well regarded across the academic public health community. It's well known, it has longevity. As leaders in this field, we're attempting to live into our vision of becoming the most welcoming and effective public health mentor program in the nation for students of all identities and backgrounds. And we don't want to leave anybody behind. Thanks a lot.
Thank you, Heidi, and thank you to all of the other presenters for sharing examples and some of the important efforts that are underway in your areas. Now I'm going to turn it back over to Dean Finnegan, who will kick off the breakout session discussions.